In my clinical practice, I've had hundreds of women sit across from me and say the same thing. I'm curious about it, but I don't know how to tell him. Not because they're embarrassed to tell their partner, but because they're afraid he won't take it seriously. They're afraid he'll turn it into a joke, or make it weird, or worse, that he'll think something is wrong with her for even having that thought. And so they stay quiet. The curiosity stays buried, and the relationship quietly misses an opportunity for deeper intimacy that it may never get back. Today, we're going to change that. We're going to talk about what's really driving that curiosity, backed by clinical research and over a decade of what I've seen in the therapy room, and what it means for your relationship when your partner finally feels safe enough to bring it up. If you're new here, welcome. I'm Dr. Ella Parker, a certified men's sex therapist with over 10 years of clinical experience working with men, couples, and the very real, very human conversations that most people never get to have. This channel exists because men over 40 deserve honest, research-backed, shame-free conversations about sexual health, intimacy, and relationships. Not locker room talk, not clickbait. Real information that can actually change your relationship for the better. If that sounds like something you want more of, hit subscribe right now. I put out new content every week, and I promise, every single video is designed to make you a more informed, more confident, and more connected partner. Go ahead, subscribe. I'll be right here when you get back. Let's start with some numbers, because I think context matters here. A lot of men assume that curiosity about anal intimacy is rare, something niche, something unusual, something that only exists in certain kinds of relationships. The data tells a very different story. According to research published in the Journal of Sexual Medicine, approximately 36% of heterosexual women have engaged in some form of anal intimacy with a male partner in their lifetime. That's more than 1 in 3 women. And here's the part that surprises most of my male clients when I share it with them. The research shows that women between the ages of 40 and 59 are more likely to have explored anal intimacy than their younger counterparts. Let that land for a moment. This isn't something that belongs to the younger generation. It isn't driven by pornography trends among 20-somethings. The data consistently shows that this is something women in long-term, established, mature relationships are thinking about, and sometimes exploring. Why does that matter? Because it means that if your partner has expressed curiosity, or if you suspect she might have curiosity she hasn't voiced, she is not unusual. She is not broken. She is not asking for something extreme. She is part of a very large, very normal group of women who are simply ready to explore something deeper with the right partner. And that partner could be you. If you understand what's really driving this, here's where most men get it wrong. When a woman expresses curiosity about anal intimacy, the first place a man's mind tends to go is physical. She wants to try something different. She's seen something. She wants more sensation. And while physical curiosity is certainly part of it, it is rarely the primary driver. And if you lead with the physical, you'll miss what she's actually asking for. Researchers have identified several core motivations, and they paint a picture that is far more emotionally rich than most men expect. Reason 1: emotional intimacy and trust. In one of the most cited qualitative studies on this topic, published in Archives of Sexual Behavior, Women described anal intimacy as more intimate than vaginal sex, and as something they reserved only for partners they deeply trusted. Think about what that means. This isn't about sensation alone. This is about a woman choosing to be more vulnerable with you than she has ever been with anyone else. It is, in the language of attachment theory, an act of profound emotional openness. When a woman is curious about this with you specifically, she is, consciously or not, telling you that you have earned a level of trust that very few people in her life have ever reached. Reason 2. Physical curiosity backed by real anatomy. Now let's talk about the body, because there is legitimate science here that most people, men and women alike, don't know. The pudendal nerve is the main sensory nerve that runs through the entire pelvic region. It has 3 primary branches, one serving the clitoris, one serving the perineum, and one called the inferior rectal nerve, which serves the anal canal. Because all 3 branches originate from the same nerve trunk, stimulation in one area can create overlapping, amplified sensations in the others. There's more. The internal structure of the clitoris is far larger than most people realize. It extends deep inside the body, wrapping around the vaginal canal and sitting in close proximity to the rectal wall. This means that certain forms of anal stimulation can indirectly activate clitoral tissue from a completely different angle. In a nationally representative survey of over 3,000 American women, approximately 43.5% reported experiencing pleasure from some form of anal touch. This isn't taboo curiosity with no anatomical basis. This is a woman's nervous system responding to real, documented physiological connections, and her wanting to understand her own body more fully with a partner she trusts. Reason 3. The psychology of the taboo humans have a complicated but very real relationship with the idea of crossing a perceived boundary in a safe context. Psychologists call this erotic transgression, the way that something being culturally forbidden can actually intensify desire and arousal when explored within a trusting relationship. For many women, the curiosity isn't just about the act itself, it's about what the act represents, a willingness to go somewhere together that most couples don't go, to share something that feels like a secret between the two of you. That kind of shared intimacy has a bonding effect that goes far beyond the physical. Reason 4. Desire for deeper partnership. Finally, and this is the one I want you to hold on to, many women describe this curiosity as coming from a place of wanting more of their partner, not something different, more. It is an expression of wanting to expand the emotional and physical landscape of the relationship. To say, I want to know you more. I want you to know me more. I want us to go somewhere we've never been together. That is not a red flag. That is an invitation. So if this curiosity is this common, and if it comes from such a genuine place, why haven't more women brought it up? In my clinical experience, the answer almost always comes down to one thing. She doesn't know if you're a safe place for this conversation. And I want to be honest with you here because I think you deserve the truth. Many men, good men, loving men, men who genuinely adore their partners, have conditioned their partners, completely unintentionally, to keep certain things to themselves. Maybe it happened the last time she brought up something slightly outside the norm and you laughed. or went quiet, or changed the subject, or said, "Where did that come from?" with a tone that made her feel like she'd said something wrong. She remembered that, and she filed this curiosity away in the same place, the place where things stay quiet because the risk of embarrassment or rejection feels too high. Research consistently shows that women cite fear of judgment from their partner as the primary barrier to sexual communication. Not shame about the desire itself, but fear of his reaction. That means the question isn't really, why is she curious? The deeper question is, have I built the kind of relationship where she feels safe to tell me? And the good news, the really important good news, is that you can start building that today. Let me be direct with you, man to professional. When your partner expresses curiosity about anal intimacy, or when you sense she might have that curiosity but hasn't voiced it, she is not asking you to immediately act. She is not giving you a green light to move fast, push hard, or assume this is a done deal. What she is asking for, what she is always asking for when she brings something vulnerable to you, is this: can I trust you with the parts of me that aren't perfectly polished? Will you receive what I'm sharing with care, without making it weird, without making me feel strange, and without turning it into something about you? The men who get this right are the men who respond to that kind of sharing with curiosity, warmth, and patience. They ask questions. They listen. They let her set the pace entirely. The men who get this wrong are the men who hear curiosity and immediately accelerate, treating her openness as permission rather than as an invitation to a conversation. Your job when she brings something like this to you is not to perform. Your job is to be present. So what does this actually look like in practice? Here are the principles I give my clients, men who want to be the kind of partner their partner can actually talk to. Create space. Don't wait for a moment. The biggest mistake couples make is assuming conversations like this will happen naturally. They usually don't. Consider creating intentional space, a relaxed evening, a walk, a moment away from screens, where you make it known that you're open to talking about anything, not pointed at this topic specifically, just open. Lead with curiosity, not agenda. There is a profound difference between asking, "Have you ever thought about trying anything new?" with genuine openness versus asking it with an agenda already in mind. She will feel the difference, always. Validate before you respond. If she shares something curious or unexpected, your first move should never be your opinion. It should be acknowledgement. Thank you for telling me that. I'm glad you felt like you could. Those words are more powerful than most men realize. Let her define the pace and the boundaries completely. If she is curious about exploration, that exploration begins with whatever she is comfortable with, which may be a conversation, nothing more, for quite some time. That is completely fine. Patience is not passive. Patience is one of the highest expressions of care. Educate yourselves together. One of the most intimate things a couple can do is learn something new together. Reading about anatomy, watching a clinically informed video like this one together, or even speaking with a sex therapist as a couple, these are acts of partnership. They signal that this is something you're navigating as a team, not something being done to either of you. Let's bring this home. When a woman is curious about anal intimacy, she is rarely, if ever, just talking about a physical act. She is talking about trust. She is talking about emotional safety. She is talking about wanting to go somewhere with you that requires her to be more vulnerable than she has been with most people in her life. The research is clear. This is one of the most common and undervoiced forms of intimate curiosity among women in long-term relationships, and it peaks in the very age group many of you are in right now. The question was never whether she might be curious. The question was always whether you were the kind of man she could bring that curiosity to. Today, you've taken a step toward becoming that man, and that matters. If this video opened something up for you, a conversation you've been meaning to have, a question you've been sitting with, I'd love to hear from you in the comments. This channel is a community, and your questions shape the content I make. If you haven't subscribed yet, please do it now. Every week I'm here, bringing you research-backed, clinically grounded conversations about men's sexual health and intimacy, the kind of conversations that actually move the needle in your relationship. And if you know a man who would benefit from hearing this, share it with him. Sometimes the most important thing we can do for the people we care about is hand them the information they didn't know they needed. I'm Dr. Ella Parker. I'll see you in the next one.